Did you know that healthcare companies with integrated subspecialty network has 44 times higher patient engagement rate? In today's episode, we will show you how healthcare practices and organizations are able to add on subspecialty networks to be able to increase revenue for their practices and solve the critical gap in patient access and not have to wait for months before getting an appointment. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. At our last Vive meeting, we were able to interview yet another two amazing founders following our series of mini interviews. If you haven't checked out the past few, make sure you go back to the previous episodes where we discovered different innovative solutions, whether it's improving market reach, as well as a patient or caregiver ability to de-stress and streamline all the care. Now, today we're bringing in the topic of how Scott Taylor is able to build a platform and solve the critical point of when we have too many digital health solutions out there, many patients actually have a significant drop-off rate because anytime we change people's behavior, adding something new, despite how good it is, we all know for ourselves, even just to remove sugar as a simple thing, it takes people a while before they can keep up or very easy to give up. Their solution are able to help patient engagement lasting 220 plus days, focusing on personalized motivation and improve digital health solutions by 30 to 50%. Our second speaker is Tracy Amato. Tracy's platform is able to connect subspecialty clinicians, especially radiology, with organizations that often are lacking those specific quick turnaround of reviewing imagings. Now, let's begin by showcasing our first speaker, Scott. Hi, we're back at Vive. This is Sabrina Runbeck. I'm here with Scott Taylor. Thank you for being here with us.
Hi, Sabrina. Great to be here.
Yes, so we are talking about how your special solutions for health are able to benefit the healthcare system and the patients and caregivers. So tell us a little bit about your mission and how are you uniquely solving a problem in the space?
Yeah, we started Perks Health to really solve what we saw as the traditional healthcare engagement problem. And a lot of people talk about that as adherence or persistence. How do you get people to do the things they need to be doing outside the clinical setting and stick to those over the long term? I think as we've evolved, we realized that there's not just a traditional engagement problem in healthcare of getting people to take their medications, do their physical therapy, attend their appointments, but also a real challenge with digital solutions around engagement. How do you use digital tools to engage people outside the clinical setting? Importantly, how do you get them to use that on a daily basis, frequently and continuously to see better outcomes? And that's really what we're focused on, is how do we enable health plans and healthcare systems to build condition management programs or gap closure programs that actually engage members day in, day out, continuously over the long term to see better outcomes.
Exactly right. When we as clinicians or whoever is making the decision and plans for the patients, if they are not doing it, then we don't know how well those decisions are actually impacting them. At the same time, we understand patients and caregivers are super busy and have other things going on, or they are sometimes dealing with multiple conditions, and it's difficult to remember when they're on 10 different medications or all these exercise rehab plans. How do you even keep up? Where do you store the information to do all those? So be able to have a system to monitor and to entreat people enough to actually do what they need to do for their own health. It's a huge thing, despite what people say about self-care, right?
Yeah, absolutely.
So how are you guys making sure people are actually adhere to their plans?
Yeah, we're really focused on a couple of things. One, we believe strongly that patients need to be treated as individuals, that everyone is different, and that goes to the type of care plan that they need. So they're not just, a diabetes patient. In many cases, there's someone who's managing multiple chronic conditions, different combinations of medications, conditions, tasks that need to be doing. So I think we need to recognize that. We also need to recognize that individuality when it comes to how we motivate them to stick to that treatment plan. So some people may just need a bit of education or a bit of information about why, managing their diabetes is really important. Other people need other motivations, so they might not be health literate and they might not necessarily be motivated by education or information. So we need to think about, could we give them some sort of financial incentive to make the right decisions? Could we gamify their treatment plan? Could we create social or accountability with caregivers or other people within their care team to ultimately drive them to engage with their care plan and stick to their care plan over time? And so that's how we really think about it, is how do you leverage the individuality of the patient but in a scalable digital solution? So when we talk to health plans and talked about how are you solving this problem at the moment, the solution that they've generally found to be most effective in managing these complex patients with multiple chronic conditions is care management. So a clinical team member or a nurse calling someone up and talking to them about what are their individual motivations. Do they want to get healthy for their grandkids, or would they be really motivated by a challenge or something like that? That's ultimately, we look to try and deliver that same impact at scale for health plans and healthcare systems that we work with, and ultimately better outcomes for those patients.
Right. It's all about individual self-motivation, because at end of the day, no one does anything but really how is that benefit for them.
Absolutely.
And all of us, despite how big grandiosity that we have that mission going forward, we have to align each individual's purpose and mission into the common goal that we wanted to provide. And that goes definitely for our end users, the patients and caregivers, as well as we build companies to be able to drive positive changes in healthcare.
Absolutely.
So with that being said, how are you guys being able to go to market? What are the strategies to make sure that the solution is in the right hands so people can actually adapt to these things?
Yeah, absolutely. And I think that's one of the big challenges that a lot of digital health companies, but also payers and providers experience, is that they design a solution that looks fantastic. It has all the clinical treatment protocols embedded in the app or in the website. It looks great. It produces fantastic reports when they're doing kind of tests, and then they look to roll it out into the real world. And you see 5% of people actually adopt those solutions. And then perhaps more scary is that there was a study that was released 2 years ago which found that the average patient who does adopt those solutions engages for about 5 days and then drops off. And that is not effective enough for long-term chronic condition management or long-term intervention. And that day-to-day behavioral change doesn't happen in less than a week. And so we often work with plans and providers to say, what are the strategies that we could use to improve uptake and increase engagement over the long term? So when we look at those numbers for Perks Health, we see between 30 to 50% of eligible patients enroll in our programs. But perhaps more importantly, that those that do enroll on average engage for over 220 days, so versus that 5 days. And I think that's super important in thinking about how do you get this solution not just into market, but actually driving real outcomes is really solving that uptake and enrollment problem and then that engagement problem that a lot of solutions struggle with. For us, we usually partner with plans or partner with healthcare systems or even partner with other digital health companies to roll this out to their members and ultimately improve outcome for those members that drives return on investment for the plans and providers.
Right, it's all about that adaptability piece. It doesn't matter how good of solution we can create, if people are not using it and not able to modify their health behavior, then we don't really have things to show them that these are actually working and beneficial. So that being said, if we give you a magic wand that will solve one of the biggest things, whatever that is, what would you use the magic wand on?
It's a good question. I think for us, it often comes down to really being able to work with payers to demonstrate the impact we can have for their population. And so I think there's often, every payer's population is unique. And so often we will start off with a pilot where we're starting with a couple of hundred, a couple of thousand members and really looking to validate the impact that it has, not just on their cost outcomes and their claims outcomes, but also on their health outcomes. That sometimes takes a bit of time to get up and running, and so I think the big one is figuring out the best way to validate and continue to validate the solution in the market, and that really requires buy-in from both the payers, but also the providers and digital health companies like us.
Right. It's a whole integrated system of talking to the right people who believe in what they can do and then give the buy-in. And then once you have more and more of these people in the ecosystem and talking to each other, agreeing on this, then that become a case study to showcase that it does work and to be able to expand out.
Definitely.
Now, we love events. That's why we're at Vive.
Absolutely.
And so what made you choose Vive and what do you really want to get out of it?
Yeah, I think our experience at Vive and also health has always been one where people are at the event and really wanting to have discussions about how we can use technologies like ours and partner with plans and providers. And really, ultimately, we're all here for the same thing, which is to improve outcomes for patients. And so I think that Vive has created a really good environment where you can connect with executives from health plans, where you can connect with investors who really understand the space, where you can connect with clinicians and even connect with patients. And we really make sure that we spend time here having discussions, understanding people's problems, and then thinking about how does that feed back into the way we're thinking about our product and our strategy going forward.
Exactly. It's that connectability piece.
Absolutely.
For sure. So when people wanted to look up more into your solution software, where do they go find you, and what's the best way to engage?
Yeah, I mean, reach out perkshealth.com or feel free to email me at scott@perkshealth.com. That's PERX health.com.
And who would you like the most to be in conversation with?
Yeah, we're always looking to speak to as many payers as possible. So we've worked across both commercial, Medicare and Medicaid. We found fantastic results with all of those populations, and I think it's probably what makes us slightly different. I mean, we see as much engagement and impact with Medicaid populations or older populations in the Medicare space. And so, really looking forward to having as many discussions with payers as well.
Awesome. Appreciate you joining us.
Thanks.
Now, are you using a digital health solution right now? And what is that patient retention rate? And also, what's the onboarding rate? Once we're able to get the patient finally using the platform solution, wearable, whatever not, how many days do they keep going? And what's the turn rate? Do you feel like Scott's solution actually helped to sustain the movements and initiative you guys are pushing out in your area? Or for those who are founders building digital health solutions, have you also thought about what is that patient retention rate on your platform? Now, if you are a founder who have a sustainable solution, we would love to hear from you. Apply to be one of our speakers, especially this week before December 20th. We have our annual collaboration with multiple other healthcare and business magazines to promote the Impact Award winners pitch competition. Go to postpointpass.com/award to apply. And we can't wait to feature you as one of the winners on our podcast. Now let's hear from Tracy on how her solution are able to white label pathology and radiology review, these subspecialties, and sometimes are hard to get to them, but with remote staffing, quickly be able to support us from a diagnostic standpoint. Hi, this is Sabrina Runbeck. We're here with Caregiving Worldwide TV Network and at Vive. Exciting to be at conferences with some amazing founders here with Tracy Amato, and she is going to share with us about your story behind the company that you guys have built and what is the true problem you guys are solving in the healthcare space.
Great, thank you. So I built MDView, which is a radiology second opinion service, and we've also built it on top of a second opinion platform. The goal of our platform is to just bring the opportunity to patients to connect with specialty physicians from home, from the comfort of home. So we're here to introduce our platform to health health systems, health providers, have them take a look at how easy and turnkey it will be to implement the MDView platform. It's a white label technology, so they can customize it and they can put their own logos and workflows within our platform. And this gives health systems a turnkey way of being able to offer second opinions to people who need them with their own team of specialists.
Right, especially when it comes to radiology, something we order all the time, and sometimes very late night, and then we always like, who's reading it? Can we just get it back right away? Like official, because as a specialist, we can say, I read it, but what about that official stamp of approval from the radiologist? Then perhaps I'm missing something. So to be able to have that quick second opinion for you guys and help the safety and quality of delivering care is so crucial. How did you guys come up with the idea of creating this platform?
So we have a long-standing history, my partner and I, in developing platforms across industries, and we've always had a special keen interest in the healthcare industry. Knowing that second opinions are so difficult to get, many patients spend months waiting for that first appointment. So to give patients the opportunity to be able to connect with a specialist from home, that is just the driving force behind our business. We did launch a radiology second opinion service that's direct to patient on our platform to prove the platform, and it's been amazing to help patients across the country get a second opinion on their radiology imaging. And we've been really fortunate enough to know that we're helping patients because many of the second opinion reads that have happened in our platform have presented new information to patients that they didn't have from their first read. So it's really proving itself to be beneficial. And just the second opinion world, so many patients want to verify and know that they have the right diagnosis. And it's so keen and really critical to keep claims costs down and to ensure the health of patients that not only are we getting the right diagnosis, but we're getting it at the right time from the right specialist.
Exactly. And when we're thinking about getting second opinion, usually people end up have to repeat the imaging and that drive up the cost. So when you guys have a platform that already have the quality of image on site where the second opinion physician can just give their best review, it also helps cut down the cost of having to find another big hospital, especially if you're thinking about cancer, when we have to scan for CAT scan, PET scan, all those different things, and be able to streamline that process and give the best comfort in the patients.
Also, it's about the immediacy of the care. We're not talking about waiting longer where delay of care is causing the problems to get worse, causing the disease to progress. And with our direct-to-patient service, we're also connecting that patient with a subspecialty radiologist. So right now, there's obviously a radiology shortage, and a lot of radiologists are taking on the burden of reading studies that, they can read, but they're not specialized in. And so having that subspecialty read just opens the door to so much more expertise by having a neuroradiologist read instead of a general radiologist or a breast imaging radiologist who doesn't read brain MRIs every day. Having that extra layer of care just makes it so much better for the patient and results in a more advanced read.
Exactly. It's about having a high quality and fast getting to the diagnosis so people can actually trust what it is, and then we can move forward to the possible treatment options so people can actually get better once they have a diagnosis.
Yes, and we want to extend that platform to the health systems because even though health systems are starting to dip their toes into the notion of supporting second opinions, and also it is a revenue stream for the health system because if they're offering second opinions to patients that aren't members of the health system today, they can earn that patient into their health system by providing a great second opinion. So by lending our platform to those health systems, they are now able to take their experts and allow their experts to offer more opinions to more patients. And that immediacy is so important. Instead of waiting for months and months to get the right doctor that's covered by your insurance, you can have a turnkey opportunity to connect with a specialist from the comfort of home.
Yes. Now, keeping that in mind, has that been your major go-to-market strategy? How are you able to make sure that the technology is actually getting in the right hands so people can actually leverage the resources and truly creating the impact you guys are hoping to make?
That's what we're here at Vive for. Our whole reason for being at Vive is to connect with the right people because we've proven that the radiology second opinion service is a great service. It's working. The platform's working amazingly. We now want to use Vive as an opportunity to take our platform and bring it to the right people.
So has conferences been working out really well for you guys? So you're focusing on major conferences to be able to be in front of these hospital systems?
This is our actually first conference where we're launching our second opinion platform. So we're really excited to be presenting it here. It's going really well, and we're looking forward to future conferences.
Amazing. And if we're gonna give you a magic wand, something just instantly disappear on your path as we are launching this for you guys, what would it be? What is one thing that needed to get out of your way so you can truly move forward?
It's really the opportunity to get in front of the right people at the right time. Every conversation we've had today and the other days of the conference have been so excellent. So it's our opportunity. We need to get in front of the right audience so that they can see our platform, see its versatility and its various use cases beyond just second opinion. We even deal with virtual care as well. So getting to those right people is the magic wand I would need.
Right, because conferences only happen so many times throughout the year. How do you continue gaining that momentum, meeting people at different locations, different spots, so they can actually truly help you to move forward? And sometimes a conference is like, hey, you're doing amazing things, so let's keep the conversation going.
Right, exactly, and that's what's been happening thus far at Vive.
Perfect. Thinking about Vive as a major place, and then you really said that it's about finding the right people and then getting you to the right system so you can have these conversations. Have you find a major domain that you're like super excited about as you're creating the platform and getting to those people? Which what I mean is, what has been some of the successful way that you have seen? Like, hey, we actually have big win, and these are the sector we really do really well on, so you know to keep doing more of.
Yeah, I think one of the biggest sectors that we're extremely interested in and becoming more and more focused on is digital pathology and whole slide imaging. Our platform is perfect for that peer-to-peer communication that is required in that industry. So that's been a great win here, as well as learning more about some AI features. We've done a lot of AI work in terms of sandbox and sending images out, getting the AI results and pulling them back into our platform. So just expanding upon that and trying to find more ways that we can bring AI in a non-intrusive way to practitioners and allow them to choose whether or not they're using the output. Those are the types of things we're focusing on today.
Yeah, that's exciting, is that we know experts have their medical degree, years of training.
Right.
At the same time, AI can help us to say, do I want to verify that?
Right.
Are we missing out anything? And just so we can, for sure, getting the right information quickly to the patients. How have you been able to say, hey, this is a place that you want people to gather and then find more about you guys, and so you can have the right conversation going forward?
In terms of here or in terms of just in general?
In general.
In general, we have our website. It's MDView.com. That's where you can learn more about our platform. You can also learn about our radiology second opinion service. And we're open to communication. We're excited to be meeting more people.
Awesome. I appreciate you for sharing the
Thanks
story.
Thanks so much. Thank you.
What did you thought about Tracy's white label solution? Is that something that you will likely adapt into your organization, or something perhaps you guys are already using? What's that experience like for those who already have similar solutions in your organization? Make sure to comment below or post your comment on LinkedIn and tag me, Sabrina Runbeck. Both founders are using personalized medicine, the way to motivate individual users for their solutions. And both leaders are really tackling the engagement question, whether it's engaging with patients themselves or engaging with clinicians to be able to bridge the gap of how do we quickly get to the result and support people where they need to be. And when we have amazing new solutions, how do we want to make sure people keep using it and continue to adapt into their lives and their workflow? I would love to hear from you guys. What are some ways you have been either creating digital solutions for your organization or for other people or healthcare entities? What's that experience look like that you have thought about to improve patient engagement or adapt solutions like collaborating with outsourcing subspecialty resources to be able to perhaps increase revenue for your organization, make sure to comment and tag me. And for all of you who are amazing founders, especially in this holiday season, we would love for you to be our next winner of Impact Award. Make sure to go check out and scan the barcode on the screen to apply. Deadline is December 20th. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.